The management for heart disease depends on the symptoms. We can have treatments where we treat the symptoms to prevent people from getting chest pain when they walk. The main treatment, however, is controlling all the risk factors, so making sure your diabetes is under control, making sure your blood pressure is under control, making sure your cholesterol is under control, aiming for it to be quite low, and critically stopping smoking is very important. We then move on to specific treatments for blockages in the arteries. If there's simple blockages in one or two arteries, we can treat that with a stent. But if there are problems in all three arteries, which are complex, then we would usually refer on to have coronary artery bypass grafting with a surgeon.
I'm Alistair Royse. I'm a professor at the University of Melbourne and Royal Melbourne Hospital, and I'm a cardiothoracic surgeon. Coronary artery disease is usually a narrowing or a blockage of one of the arteries that are supplying blood to the heart itself. And the two standardised techniques that are currently available, which is cardiology Percutaneous Intervention, PCI, which is to put a wire down the artery itself and make the narrowing less narrow. Or the alternative is coronary artery bypass surgery, where we provide a tube to deliver blood downstream of where the narrowing or blockages are. Coronary artery bypass surgery has the best long-term outcome as far as both survival and recurrence of symptoms needing further interventions. Typically, an operation takes half a day. Somebody goes to the intensive care unit routinely, typically 1 or 2 days, then out to the ward, often home 5 to 7 days after the surgery. Quite a lot of patients are very limited in what they can do. They're in fact almost invalids because their symptoms stop them from doing things. But then after they've recovered from the surgery, they can do much more. Simply because when they exercise and they need their heart to pump more blood to be able to do that exercise, it can, because it itself has a better blood supply.
My name's Sarah Phillips. I'm a senior dietitian at the Royal Melbourne Hospital. A really healthy, balanced diet is the best thing to reduce your risk of heart disease. So having lots of fruits and vegetables, whole grains, fibre, a bit of dairy is good, and some healthy protein sources, so your meat or legumes or tofu. Fish, in particular oily fish, is a really great source of omega-3, and that can reduce our risk of heart disease. And then certain foods do increase our risk of heart disease, so foods that are really high in salt, often takeaway foods or chips or heavily processed meats. And other foods that can increase our risk of heart disease are things that are really high in saturated fats. So again, that's often our takeaway food or our deep fried foods, cakes and pastries, and certain types of fats and spreads like butter are high in those unhealthy fats as well. It's never too late to try and start eating healthier, so you don't have to go from changing everything all at once. You can just pick one small change to try and improve your diet, whether it's have an extra vegetable or fruit in the day, or try and have a little handful of nuts to snack on, trying to include fish every now and then. Those small changes can still make a big difference.
It's important to identify all the risk factors early, such as diabetes, high blood pressure and high cholesterol. And we can check these with your GP or with your cardiologist, and if they're found, we can treat them early. The good thing with coronary heart disease, it's one of the most manageable diseases that we have in medicine. We have a lot of treatment for the risk factors, we have a lot of treatment for established heart disease, so it's important that you get to your GP or your specialist, make sure you get your risk factors under control, and make sure you get your lifestyle factors under control, in particular your weight and your exercise.